Welcome to Elderly Care and Advice Channel. Have you ever wondered why you keep waking up at exactly 3 a.m., no matter how tired you feel? You're not alone. Many older adults struggle with this frustrating sleep pattern, but most don't know why it happens. Could it be stress, an aging body, or a hidden health issue? Dr. Donald Paul, a medical expert with 29 years of experience, explains that waking up at night can be a natural part of aging, but sometimes it signals an underlying problem. Understanding the real cause can help you sleep better and feel more refreshed. Let's uncover the 7 major reasons behind this mystery. Before we begin, I would appreciate it if you like this video. You can help me continue to spread the age-old lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell notification so you don't miss any videos. If you like this video, please comment yes. If you don't like it, comment no to let me know so I can make a better video for you. Now, let's get started. 1. Melatonin production declines with age. Have you ever noticed that older people tend to fall asleep earlier in the evening but wake up much earlier than younger adults? This is largely because of changes in melatonin production. Melatonin is a natural hormone that controls our sleep-wake cycle. It tells the body when it's time to sleep and when to wake up. However, as we age, our bodies produce less melatonin, making it harder to stay asleep throughout the night. Dr. Donald Paul explains that melatonin levels start to decline as early as middle age, and by the time a person reaches their 60s or 70s, their body may not produce enough to maintain deep sleep. This reduction in melatonin can cause lighter sleep, frequent awakenings, and difficulty returning to sleep after waking up. That's why many older adults find themselves waking up at 3 a.m. without any obvious reason. So, what can you do about it? Dr. Paul recommends a few natural ways to boost melatonin production. Limit screen time before bed. The blue light from phones and TVs reduces melatonin levels. Create a dark sleeping environment. Use blackout curtains to signal your brain that it's nighttime. Consider melatonin supplements. A small dose may help, but always consult a doctor first. Follow a consistent sleep schedule. Going to bed and waking up at the same time daily helps regulate melatonin levels. By making these small adjustments, you can improve your sleep quality and reduce nighttime awakenings. 2. Frequent urination, nocturnal, disrupts sleep. Waking up in the middle of the night to use the bathroom is one of the most common reasons older adults find themselves awake at 3 a.m. This condition is known as nocturia, and it can severely disrupt sleep quality. While occasional nighttime urination is normal, frequent awakenings to empty the bladder can make it hard to get enough restful sleep. Dr. Donald Paul explains that as we age, the body undergoes changes that increase the likelihood of nocturia. One major factor is a decrease in the bladder's ability to hold urine for long periods. Additionally, the body's ability to concentrate urine weakens, which means more urine is produced at night, leading to frequent bathroom trips. Several medical conditions can also contribute to nocturnal. Enlarged prostate, BPH, in men. The prostate gland grows with age and can press against the bladder, making it harder to hold urine. Weakened bladder muscles in women. Pregnancy, childbirth, and menopause can weaken bladder control, causing more frequent urination. Diabetes. High blood sugar levels can lead to excessive urine production, making nighttime urination more common. Heart or kidney problems. These conditions can cause fluid buildup in the body, leading to increased urine production at night. How to reduce nighttime urination. Dr. Paul suggests the following strategies to manage nocturia and improve sleep. Limit fluids before bed. Avoid drinking large amounts of water, tea, or juice in the evening, especially 2 hours before bedtime. Reduce caffeine and alcohol intake. Both substances act as diuretics, increasing urine production and making the bladder more active at night. Elevate your legs during the day. If fluid buildup in the legs is an issue, raising them while sitting or wearing compression stockings can help redistribute fluids before bedtime. Empty your bladder before sleep. Make it a habit to use the bathroom right before bed to reduce the chances of waking up at night. Talk to a doctor. If nocturnal is persistent, a medical professional can check for underlying health conditions and suggest treatment options. By addressing nighttime urination, you can significantly improve sleep quality and reduce those frustrating 3 a.m. wake-ups. 3. Increased stress and anxiety. Have you ever woken up at 3 a.m. with your mind racing, thinking about past mistakes, future worries, or things you can't control? You're not alone. Stress and anxiety are major reasons why older adults struggle to stay asleep. When the brain is overly active, it becomes difficult to relax and return to sleep. Dr. Donald Paul explains that as people age, they often experience more life changes that can trigger stress. Concerns about health, financial stability, family issues, or even the fear of aging itself can create anxiety that affects sleep patterns. The body responds to stress by releasing cortisol, a hormone that keeps the brain alert. If cortisol levels remain high at night, it can disrupt sleep cycles and cause frequent awakenings. How to reduce nighttime stress and sleep better? Dr. Paul suggests several strategies to calm the mind and improve sleep quality. Practice relaxation techniques. Deep breathing, meditation, and gentle stretching before bed can help lower stress levels. Write down your thoughts. Keeping a journal allows you to release worries onto paper instead of carrying them into sleep. Follow a bedtime routine. A consistent pre-sleep routine signals the brain that it's time to relax. Avoid negative news or social media before bed. Stressful content can increase anxiety and make it harder to unwind. By managing stress and anxiety, you can create a more peaceful sleep environment and reduce the chances of waking up at 3 a.m. If you're still watching this video and finding these insights valuable, please comment yes below to let me know you're here. If you haven't subscribed yet, I recommend you subscribe and turn on the bell notification so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward. 4. Chronic pain and medical conditions. Do you often wake up at 3 a.m. feeling discomfort in your joints, back, or stomach? Chronic pain is a major reason older adults struggle to stay asleep. Unlike younger people, whose bodies can often ignore minor aches, older adults may find even mild pain disruptive at night. This is because pain perception increases when the body is at rest, making nighttime discomfort more noticeable. Dr. Donald Paul explains that common age-related conditions can cause pain that interrupts sleep. Arthritis, inflammation in the joints can worsen at night due to reduced movement and lower body temperature. Acid reflux, GERD, lying down after eating can cause stomach acid to rise into the esophagus, leading to heartburn and discomfort. Nerve pain, neuropathy. Conditions like diabetes can cause burning or tingling sensations in the feet and legs, making sleep difficult. Fibromyalgia, a condition that causes widespread body pain and sensitivity, often worsening at night. How to manage pain for better sleep. Dr. Paul recommends these strategies to reduce nighttime pain and improve sleep. Use supportive pillows. A pillow between the knees can ease back and joint pain, while an elevated head position helps with acid reflux. Take prescribed pain relief before bed. If recommended by a doctor, the right medication can help control pain overnight. Apply heat or cold therapy. Heating pads or ice packs can reduce inflammation and soothe sore muscles. Avoid heavy meals before bed. Eating too close to bedtime can worsen acid reflux and discomfort. By managing pain effectively, you can prevent unnecessary awakenings and enjoy deeper, more restful sleep. 5. Sleep apnea and breathing problems. Do you ever wake up gasping for air or feeling like you're choking? If so, you may have sleep apnea, a serious condition that affects many older adults. Sleep apnea occurs when breathing repeatedly stops and starts during sleep, leading to frequent awakenings, often around 3 a.m. Dr. Donald Paul explains that the most common type, obstructive sleep apnea, OSA, happens when the throat muscles relax too much, blocking the airway. This can cause loud snoring, gasping, or even moments where breathing stops completely. The brain then sends an emergency signal to wake you up just enough to restart breathing, which explains why some people find themselves awake at odd hours without knowing why. Common signs of sleep apnea. A loud snoring. A gasping or choking during sleep. A waking up with a dry mouth or headache. A feeling excessively tired during the day. How to improve breathing and sleep quality. Dr. Paul suggests these steps to manage sleep apnea. Maintain a healthy weight. Excess weight can put pressure on the airway. Sleep on your side. Sleeping on your back can worsen airway blockage. Use a CPAP machine. This device keeps the airway open and improves sleep quality. Avoid alcohol and sedatives. These relax the throat muscles, making apnea worse. Addressing sleep apnea can help prevent 3 a.m. wake-ups and improve overall health. 6. Medications that affect sleep patterns. Did you know that some of the medications you take daily could be the reason you keep waking up at 3 a.m.? Many older adults rely on prescriptions for conditions like high blood pressure, diabetes, depression, or chronic pain. However, certain medications can disrupt sleep by causing frequent awakenings, lighter sleep, or increased nighttime urination. Dr. Donald Paul explains that some medications have stimulant effects, which make it harder to stay asleep. Others may cause drowsiness at first but later disrupt deep sleep, leading to frequent awakenings. Common culprits include blood pressure medications, beta blockers, diuretics. These can lower melatonin levels and cause nocturia. Antidepressants, some types, especially SSRIs, can interfere with sleep cycles. Steroids, e.g., prednisone, often used for inflammation, steroids can make people feel restless at night. Allergy and cold medications. Some contain ingredients that cause drowsiness but can also lead to poor sleep quality. How to improve sleep while taking medications. Dr. Paul suggests taking medications earlier in the day, if approved by your doctor. Asking your doctor about alternatives with fewer sleep side effects. Avoiding caffeine and alcohol, which can amplify sleep disturbances. By adjusting medication timing and discussing alternatives with a doctor, you may be able to reduce those unwanted 3 a.m. wake-ups. If you're still watching this video and finding these insights valuable, please comment yes below to let me know you're here. If you haven't subscribed yet, I recommend you subscribe and turn on the bell notification so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward. 7. Poor sleep habits and lifestyle factors. Have you ever found yourself scrolling through your phone or watching TV right before bed? Or maybe you drink a glass of wine in the evening, thinking it will help you relax? While these habits may seem harmless, they could be the reason you keep waking up at 3 a.m. Dr. Donald Paul explains that poor sleep hygiene, the habits and routines surrounding sleep, plays a big role in how well you rest. Many older adults unknowingly sabotage their sleep by engaging in behaviors that disrupt their natural sleep cycle. Some of the most common mistakes include using screens before bed. The blue light from phones, tablets, and TVs reduces melatonin levels, making it harder to stay asleep. Drinking alcohol before bed. Alcohol might make you feel sleepy at first, but it actually leads to lighter sleep and more frequent awakenings. Having an inconsistent sleep schedule. Going to bed and waking up at different times each day confuses your body's internal clock. Eating heavy meals late at night. This can cause indigestion or acid reflux, making it uncomfortable to sleep. How to fix poor sleep habits. Dr. Paul recommends keeping a consistent sleep schedule, even on weekends. Avoiding screens at least an hour before bed. Creating a relaxing bedtime routine, such as reading or meditating. By improving sleep habits, you can enjoy deeper, uninterrupted sleep and avoid those frustrating 3 a.m. wake-ups. Conclusion: how to improve sleep and stay asleep longer. Waking up at 3 a.m. can be frustrating, but understanding the root cause can help you fix it. Whether it's declining melatonin levels, frequent urination, stress, chronic pain, sleep apnea, medications, or poor sleep habits, small changes can make a big difference. Dr. Donald Paul emphasizes that quality sleep is essential for overall health. By following a consistent sleep routine, managing health conditions, and making smart lifestyle choices, you can enjoy deeper, uninterrupted sleep. Don't ignore frequent nighttime awakenings. Your body might be trying to tell you something. Prioritize sleep, and you'll wake up feeling refreshed and energized. Please drop a comment below this video with one thing you've taken away from this and how you plan to put it into practice in your life. This action might be of help for someone else around you. If you like this video, please leave your comment below, and don't forget to like, share, and subscribe to our YouTube channel for more tips to help you stay strong and savvy. Take care of yourself. You're created to live long, stay healthy, and enjoy life. Thanks for watching.